This patient video has been produced with the support of an educational grant from Nutribytes, manufacturers of high fibre. The company has had no involvement or influence over the content of this video. Childhood constipation. This Nutribyte will describe some general first-line dietary advice on constipation in children. Please note, for more individualised advice, speak to your GP or dietitian. What is constipation? Constipation refers to difficulty passing stool, or not passing stool regularly enough. This might be because the stool is too large or too hard, or is not being moved through the bowel quickly enough. Causes of constipation. There are many causes of constipation in children, including withholding and refusing to poo following previous painful bowel movement, stress and anxiety, certain medical conditions, eating and drinking habits, including lack of regular food, fibre or fluids, and in some cases, food allergies or intolerances. Sometimes the cause is not clear. Why is constipation a problem? Short-term side effects include tummy discomfort, pain when trying to pass a stool, and loss of appetite. This may also affect mood and behaviour. Long-term side effects include small tears around the bottom, anal fissures, swollen veins, hemorrhoids, fecal impaction when lots of hard stool becomes stuck in the bowel, and deterioration in nerves and muscles in the bottom, leading to more toileting accidents, like fecal incontinence. Managing constipation at an early age can help to minimise these complications. What are some of the common signs and symptoms? These may include passing stool 3 times or less per week, abdominal discomfort or pain, particularly on the left-hand side, stool being either large and hard or in small pieces like rabbit droppings, straining or feeling pain in the bottom when trying to pass stool, bleeding from the bottom whilst passing stool or afterwards, and having tummy pain or a poor appetite, which improves after passing stool. How can diet help? The best way to control constipation is with diet. Any small changes you can make will be really helpful. Getting enough fibre is especially important, as most people don't have enough in their diet. However, it is also possible to have too much fibre, so here are the general recommendations. 15 grams per day for 2-year-olds, increasing up to 30 grams per day for 18-year-olds. To get more fibre, try some of these foods: fruit and vegetables, oats and cereals, beans and pulses, and wholemeal bread. And remember, it is important to increase your child's fibre intake gradually, whilst also aiming to increase fluid intake. Fibre and fluid work as a team to help keep the stool soft and easy to pass. Some other supplements may also be helpful. You can discuss this further with your doctor or dietitian. Remember, even making some small changes can make a big difference. If the constipation has been going on for longer than 3 months, then dietary changes on their own are unlikely to be helpful, in which case children will likely be given medications such as laxatives, stool softeners, or a fibre supplement from their nurse or doctor. These medications are helpful for many children and often need to be taken in large doses to help soften the stool enough to make it painless to pass. Medications combined with changes to diet and toileting behaviours can be successful in addressing the cause of chronic constipation. Here are a few little Nutribyte tips to help include more fibre in your child's diet. We hope you have enjoyed this Nutribyte video on paediatric constipation. For more information, access some of the links provided in the description below.